Rafik Youssif, Pharmacy Manager at Sheikh Khalifa Medical City, which is managed by Saha. I'm here to talk about several issues regarding the GCC and pharmacy practice in general. The pharmacy practice is evolving very quickly in our area, which is excellent, and this progress is mainly focused on improving the safety of medication management and handling in our region, whether in terms of using lean techniques, JCIA techniques, automation, or updated softwares that would allow better handling and safety practices in the pharmacy profession. We keep up to date mainly in Saha hospitals with the new trends and advances in the profession through several ways. Number one, we have very good networking system that involves a lot of committees and a lot of forums which combine different categories of the pharmacy profession or the healthcare profession in general into committees and forums that discuss the new trends in treatment and new modalities, new technology implemented, and then this information is filtered down to the staff regularly or in the form of projects and initiatives that are rolled out across hospitals to improve the medication safety and handling. Also, UE is privileged to have several international conferences that have international speakers who are well experienced with the new technologies, new treatments, new modalities, new discoveries in the field of medicine and pharmacy profession in general, and this gives a chance to the pharmacists in general who attend these conferences to be aware of what's going on around them in the world, and even for some of them to adopt in their facilities the new techniques or new technologies or even the new drugs launched in advanced worlds, even sometimes at the same time it's being launched there in the country of origin. In addition, we have access to some international references that are updated frequently, maybe even monthly, and hence our pharmacy professionals keep up to date with new trends once they need it at their fingertips. Talking about the barcode technology and its usefulness for the pharmacy professional on three different levels. Number one, the positive patient identification in the inpatient settings, where the computer identifies the drug, identifies the patient, and tells the nurse whether this is the right drug at the right dose at the right time for the right patient or not. Second level will be in terms of automation, which is the new initiative taking place in the UEE, where automation will provide more efficacy for medication handling and safer environment, and barcoding is at the core of implementing these initiatives because machines usually read barcodes only. They don't read writings, they don't read letters, but they read barcoding. So we'll talk about that as well. A third and very important new trend that uses barcoding is developing in the advanced world, which combats or blocks the illegal side of trading drugs through different technologies using the cloud technology and information systems, and we would like to see this also rolled out in the UAE, where we all live and love to have the highest levels of medication safety. What I'm trying to achieve from speaking about this and moderating the forum that will be held at GCC is to have a unified practice and even have the managers and the regulatory bodies coordinate with us to implement and mandate having barcodes on all medications that are brought into the country, and then provide the tools to use these barcodes in the three levels that we talked about, whether to identify the right patients and the right doses, or to have to counter any illegal attempts to bring illegal medications into the country, and third, of course, to help with the automation. We need to have standardized tools, standardized practices, and standardized system of reading these barcodes on medications so there will be no confusion. I believe the GCC conference is becoming a very important conference because, number one, it has very diversified audience and population from all the Gulf countries, and it has included both the pharmacists and the regulatory bodies and the top admins in different countries. Hence, the information is shared and mutual initiatives can be agreed upon even between the countries themselves on the top level of regulatory bodies or syndicates to improve the pharmacy practice in a unified way and catch up with the advanced world in these terms. Thank you and hope to see you there.